other people, we'll have other people joining us. So we have an action-packed evening about Medicare. And we have some awesome guests here tonight. My name is David Saunders. I am of course, I've been with Equity Concepts. I'm in my 22nd year. I'm the senior relationship builder. And I know a lot of you guys know who I am. So I'm not going to do a bunch of talking because I got to turn it over to the experts. But tonight we do have Brian Gay, who is the owner of Boomer Insurance Group. And he has a extensive background, 17 years advising his clients on this area. We also, from Boomer, have Bill Medlin, who I've known for 22 years. And Bill had a successful career at Equity Concepts. And we always tell our clients, you can't retire to nothing. You got to retire to something. And Bill retired to helping his demographics with Medicare. And so it's cool that Bill transitioned into eating his own cooking and helping people that are in his demographics. I like to start with a quote that I feel is very timely for tonight. And then I'll turn it over to our experts. So this quote is in our lobby, and a lot of people have probably have heard it, but I'll read it word for word. It says this: there are two systems of taxation in our country, one for the informed and one for the uninformed, and that's Judge Leonard Hand. And so this is a government system as well. And I will tell you, I know firsthand with referring clients to Brian and Bill that when they are able to help someone, they become the informed. And I will tell you, when they do come across someone that has not been able to get the right help, it really can make a huge difference in what kind of benefits that you take advantage of when you have someone representing you versus just, sort of rolling the dice and hoping that you've gotten the right counsel. So tonight, we're putting our clients in a position of being informed. And with that, I'm going to turn it over to Brian and Bill. And thank you so much for being here tonight, guys.
Perfect. Thanks, David. What I'm going to kind of go through, we'll try to keep on track and on time. We're trying to keep this always to right about an hour. Is usually about the extent of most people's attention span when it comes to governmental health insurance. But that quote is pretty fantastic when it talks about at least our industry as well, because it is dealing with another federal entity. Obviously, taxation deals with IRS and Medicare deals with the Department of Health and Human Services. So it's kind of odd that people, when they're turning 65 or coming into Medicare, they get these weird phone calls and mailers and all this contradictory information and all that kind of thing. And it's weird because they get all those phone calls, but with our licenses, we have a kind of an advanced licensing and credentials that allow us not to contact anybody. People actually have to contact us directly, which is kind of weird. The higher up on the food chain you go, the more limited your reach can be sometimes. So I'm just going to dive right in. What we're going to do is I'm going to go through a quick presentation on Medicare, the quickest I can, and explain it the way I understand. Also, Bill Medlin is with us tonight. He's one of our agents at Boomer Insurance Group, and he's going to help with a question and answer session at the end. A little bit more detail about me personally. I definitely need to update my bio, so sorry about that, David. This is my 20th year dealing with Medicare insurance, and we've helped a little over 13,000 people understand Medicare insurance over the years. So who I am, if you start to hear some of the kind of country style draw, I'm originally from Oklahoma. There was a lot of Michigan talk at the beginning. That's my wife, who's very smart and sophisticated. I'm the country bumpkin from Oklahoma. So if you hear some bad grammar, that's 100% my fault. I was raised by my grandparents actually in Oklahoma. My grandmother was a school teacher. She took all four of us kids on when my parents passed away. So, short story there, my grandmother was 68. She took all four of us. I was the favorite because I was only 6 months old. So, my brother was 3, my sister was 10, my oldest sister was 13. But as soon as I could walk at 1.5, 2 years old, when kids start learning how to walk, my mom, my grandmother, was 70 at the time. So the only people who I've ever been around my entire life were in their 70s and 80s and 90s, and she passed away at 101. So anybody who says they're 65, I call them my youngins, my 65 to 75-year-olds. Those are the youngins in our business here. So that's who I am, who we are as a company, is we only deal with Medicare insurance. So Boomer Insurance Group is a local agency in the Richmond, Virginia area. We do help people outside of Richmond, pretty much all over Virginia. We help a little bit of people in Maryland and DC and North Carolina, South Carolina, but our main focus, and really where we love to stay the majority of our time, is Virginia. The reason why we ended up picking up these other states is because some of the government municipalities will send us business and they'll send us referrals. We deal a lot with Philip Morris retirees and that kind of thing. But if you ever have any questions relating to Medicare insurance or Medicare related questions, please feel free to reach out to us at our agency. We'd be happy to answer those questions. We are a broker, so we deal with every single Medicare insurance company that people can buy. So the Humanas and the Anthems and the United Healthcares, the Cignas and Aetnas of the world. We are not affiliated with Joe Namath. Oh my gosh, the guy on TV, Joe Namath, please don't ever fall for those things. And the new Jimmy Walker Dynamite commercials, please don't fall for that. But so that's who I am, who we are. And then I mentioned about our advanced licensing. Let's talk about what we are not going to discuss today. We will not be discussing certain retiree benefits that people have when they go to retire, such as the federal employees, because federal employees, they play by a totally different rule book than everybody else. So we're not going to talk about the federal employee health plan. If you guys have questions about that, we'd be happy to answer those questions. We're not going to talk about military benefits tonight. So there's something called TRICARE for Life, or just veterans benefits. We're not going to discuss those either. We're not going to discuss a lot of the group available plans, like from the Commonwealth of Virginia. Again, we know all about these plans, but that's more of an individual topic, and it doesn't pertain to everybody. So what we're going to talk about tonight are the options available to everybody. So that's what I think is probably the most important, and give you a generalized overview of the Medicare program and kind of what the pros and cons are for both of your options that you would have availability. So without further ado, I'm going to pull up a presentation and then go through that. I did say I was raised by a school teacher, so I would highly recommend that you guys take notes. I just recommend that because I can't physically force anybody to at this point. But please go ahead, write down everything that comes on the screen. And if you would like to write anything else down that I mentioned, if you want to write it on a totally separate sheet of paper, that might be a good idea. But we're going to end up with 2 sets of sheets of paper. We're going to have option number 1 and option number 2. So it might go dark for a second while it flips over for certain things. I am not the most computer savvy person all the time, which you'll figure out pretty quickly. And we'll see how all this works out. Okay. And David, can you see my computer screen? Bill, anybody?
Yep, can see it.
Okay, thank you. So my contact information and our contact information is currently on the screen. Everybody knows how to get a hold of us. Everybody at Equity Concepts knows. You can Google Boomer Insurance Group. It pops up pretty quickly on Google. But what I'll start off with also saying is when people are turning 65, that is typically the time people start inquiring about Medicare insurance, whether they need it, whether they don't need it, whether they should enroll, whether they should not enroll. And the problem with Medicare, another bad joke, it's clean, it's just not funny, but a bad joke is Medicare is kind of like politics and religion, because everybody's opinion is the right one. So what they did with their Medicare insurance is exactly what you should do with your insurance. The problem is it's not a one size fits all, and each person is individualized. Actually, even husbands and wife or spouses, they don't even need the same insurance. Sometimes people take different prescriptions, they go to different doctors, they have different health concerns. So it's all individualized. One of the major things that come up with problems that we see quite often is enrolling into Medicare. Because just enrolling into Medicare is very cumbersome. It's also kind of confusing. And here's why. If you do not sign up for Medicare when you were supposed to sign up for Medicare, you're going to get penalized the rest of your life by the government charging you an extra fee for not signing up when you were supposed to sign up. But there's another problem, because what about the people who actually sign up? They sign up when they were not supposed to sign up. Well, those people who signed up when they were not supposed to, they get penalized by the IRS. So you got to be careful, because Medicare, just enrolling into Medicare is one of those things that you're kind of darned if you do and darned if you don't do the right things for your particular circumstances. So without further ado, we're going to get into the Medicare programs and how those two programs work in those two options. Because while there's no shortage of insurance companies like Anthem and Humana and Cigna and United Healthcare trying to sell insurance, if you guys boiled it all down, distilled Medicare down to the basics, at the end of the day, you're only going to have two choices. These are the choices the public has available to them. So at the end of the day, when you need Medicare, you are either going to choose option number one, or you're going to choose option number two. So on these sheets of paper that I'm going to have you write things down on, I'm going to have you write down on a sheet of paper option number one. And this is going to also begin a number of funny analogies and ways for people to remember how these different programs work. Okay, so on your sheet of paper, if you want to write down option number one and the word car in quotation marks, that's because it works exactly like a car. Now, you don't have to write anything down else right now, but think about it.
Excuse me, Brian.
Sure.
Can you, I believe if you hit slideshow, it may increase the size for the viewers of what you're using.
Let's see. Thank you.
There we go.
It might. Thank you for saying that. Let me see if I can. It changes all the time. Every time I do one of these things. See if this works. Is that any better? I think this might help. Sorry, you guys.
That's better than it was.
Okay. How's that? Much better?
That works. Perfect.
Okay, thanks. All right, so option number one is like a car. So if you think about it, people do not buy a car to save money. I mean, it's a depreciating asset, a car. The reason why people want to buy a car is because they want to go where they want to go. They want freedom and flexibility. They want to go when they want to go. They want to go where they want to go. And they kind of just want to go because they want to go. Those are the people who choose option number one. So you guys, option number one is going to end up costing you a little more money over retirement because it's kind of the luxury plan. So you kind of do get what you pay for, but let's talk about how option number one works. Option number one is a puzzle, and that puzzle is comprised of three separate pieces. Those three separate pieces are going to be three separate ID cards. Now you got to have all three ID cards to equal option number one. So because you need all three, we're going to systematically go through each of those three ID cards, which would be three policies. So on your sheet of paper, if you want to write the number one, and then go ahead and write the words Medicare A and B, primary insurance. And I'll stop a few times and I'll also continually say the same thing over and over again. It's not that I'm trying to talk down to anybody. It's just while people write things down, sometimes their brain doesn't hear the next thing that I say. So if I say the same thing over and over again, it's because I'm saying the same thing over and over again. But Medicare would be your primary insurance if you chose option number one. Now, Medicare is just health insurance, you guys. We don't have to church it up too much. You pay a fee, you get a card, you take the card to the doctors, you show the card to the doctors, you have deductibles, you have copayments. It's just health insurance at the end of the day. Now, Medicare has these two separate parts, which are Part A and Part B. Part A is insurance for the hospital, basically. Again, we're going to keep this pretty high level, but inpatient hospitalization care is covered by Part A. And when people go to retire, they don't have to pay for Part A anymore because you have been prepaying for Part A your entire working life. If you ever looked at a pay stub anymore, which most people don't, but if you looked at a pay stub, before you get your money, if you notice, FICA comes out, and then the federal taxes come out, and then the state taxes come out. And then there's this funny little line item on your pay stub that says the word Medicare. That Medicare line item on your paycheck is paying for Part A. But when people go to retire, it's considered paid up, and you do not have to pay for Part A anymore. Please don't let anybody tell you it's free. That's one of my pet peeves. It ain't free. You've paid thousands of dollars into Part A. So it's just called paid up. Now, Part B is something totally different. Medicare Part B is for outpatient services like doctor visits or lab work, or an emergency room visit is outpatient. An ambulance ride is outpatient. But some people have outpatient surgeries like cataract surgeries or shoulder surgeries. All of that falls underneath Part B because those are outpatient services. Now, we have not prepaid for Part B, so we have to start paying for Part B. And if you notice on your screen, it shows now where Part B currently costs $148.50. So I'll have you guys jot that down, $148.50 Part B monthly payment. Now that is the base rate. Don't forget that. That's the base rate for Medicare. Everybody pays $148.50 who is on Medicare. Part B. Some people have to pay more than the base rate because their income is so high. So just like anything else, when you make a lot of money, the government comes after you with pitchforks and torches. So what ends up happening is people who do have a higher level of income when they go to retire, they end up paying a little bit more for Part B. Okay, so that's paying for Part A, that's paying for Part B. Now that we have Medicare Part A and Part B, now that we have this one ID card, how does it work? Well, let's talk about that. It just popped up on your screen, hopefully. Go ahead and jot that down. But see, Medicare will pay 80% of your medical bills, 80% of your hospitalizations, 80% for chemotherapy, 80% for a CT scan or an X-ray. But Medicare will not pay the 80% until after you've met your Medicare deductible of $203. Well, that's a funny deductible. It works like any other deductible, but how that works is you as an individual, you have to pay the first $203 of your medical expenses. You're kind of on your own. You pay those doctors, you pay the blood work, you pay those things until the first $203 is out of your pocket. And after that, Medicare pays 80%. Great. It's the majority is 80%. The problem is Medicare is going to leave us with this leftover 20%, and the 20% that's left over is unlimited. Medicare does not have a maximum out of pocket. If the bills are $500,000 that year and you are on the hook for 20% of $500,000, that's $100,000. That can get pretty expensive. Nobody wants to pay 20% of medical bills. So what we do is we do other things we don't want to do, which is buy more insurance, which brings us to the second ID card. Now, the second ID card would be another policy, an insurance policy. That insurance policy would be called a Medicare supplement. So go ahead and jot that down. But if you notice next to the word supplement, it says the word Medigap in parentheses. Well, they have to name everything at least twice to confuse everybody. So just so you guys know, the word Medigap is the slang name for Medicare supplement. It's like a nickname. The proper terminology is Medicare supplement. So go ahead and underline supplement. Now, these supplements are done by insurance companies like Anthem Supplements or Humana Supplements or AARP Supplements or Cigna Supplements. So you got to pay for them. It's insurance. If you notice on your screen now, the average monthly payment for a Medicare supplement plan is around $115 per person per month. So which means some people pay a little more, some people pay a little less, but a typical 65, 66, 67-year-old person in Virginia is going to be paying right around $115 a month to an insurance company to purchase their Medicare supplement plan. Okay, so now that we've donated another $115 a month to an insurance company, let's talk about how that works. So on your screen, go ahead and click and go ahead and write that down, what just clicked on. It says the supplement will pay all of the 20% after Medicare pays the 80%. That's very important. Medicare has to pay first. Medicare is the primary. Medicare is paying 80%. But as soon as Medicare pays their 80%, the supplement automatically pays the leftover 20%. So people can go to any doctor in America because Medicare is national. So they go to any doctor in America, and all that doctor has to do is just bill Medicare, which is important. And the large majority of doctors bill Medicare. I know what's on TV, and I know what's on news, and I know what things pop up on Facebook, making it sound like the sky's falling and the earth is heating up to unsustainable things. I'm going to tell you right now, most doctors in America bill Medicare. So you're 100% covered after Medicare pays 80 and the supplement pays the 20%. So if you guys have any older friends or family, if they ever tell you things like, well, I went to the doctor and I didn't pay anything, or I just got out of the hospital and I didn't pay a dime. I just had surgery, didn't pay anything. Well, that's true. They didn't really pay anything while they were at the hospital or when they went to the doctor. They didn't pay while they were going, but they're paying an extra $115 a month for their supplement plan. So don't let them fool you. They are paying for something. Now, I mentioned to get the card, to get option number 1, you needed 3 ID cards. And the reason why you need a third ID card is because Medicare does not cover prescription drugs. So we do need that third ID card. So I'll go ahead and have you jot that down. The third ID card, it's known as a Part D, as in David, drug plan. Okay. Part D, drug coverage. Drug coverage is a government program. Part D is a government program, but that program is administered by insurance companies. So you don't get a Medicare drug plan, you get a Humana drug plan or a Cigna drug plan or a United Healthcare drug plan. Right now, there's 30 drug plans to choose from in Virginia. We do all 30, so it doesn't really matter to us, but it does matter to the consumer because different insurances, different drug plans cost different amounts. They also cover different drugs, and the cost of those drugs are dependent on which pharmacy people use and which insurance they use at that pharmacy. It gets kind of complicated. But on average, we're just going to keep it again high level. The average monthly payment for a drug plan is right around $30 a month. So you can jot that down. So $30 a month average monthly payment for a drug plan. Well, if you guys have health insurance, which I'm sure you do, what happens is you take your insurance ID card to the pharmacy and your prescriptions are normally not just free all the time. Usually people have some kind of payment that they have to pay at the pharmacy. So let's talk about how this drug plan works. The normal, average, typical drug plan, if you notice on your screen now, the typical drug plan has a deductible of $445. So jot that down, $445 drug deductible. And then even after you met that drug deductible, you would still have co-payments for drugs. Those co-payments are very reasonable most of the time, pretty much all of the time. So one of my customers today, she's taking an inhaler that's about $700 a month. It's a lot of money for an inhaler. She's only going to pay a $30 copayment for that $700 inhaler. But she's going to have to meet that deductible first. So next month in October, when her plan starts, she's going to have to pay the deductible, then her copay, and then the rest of the year, she's just going to pay her $30 copay for her inhaler. So that's how that works. So to briefly recap, option number 1, you have 3 ID cards. You have your Medicare card, your supplement card, and your drug plan card. You can go to any physician, any hospital, any doctor in America. They just have to bill Medicare, just bill your insurance. And when that happens, you cover your deductible, the $203 deductible, and you're covered 100%, except for having to pay co-payments at the drugstore the rest of the year. So you always have co-pays for drugs. So that's how option number 1 works. So now we're going to leave option number 1. And again, we're going to have a question and answer session at the end. So if you guys have questions, jot the question down on a sheet of paper and we'll answer them here in just a minute. But that's option number one with Medicare, which is Medicare supplement plans. Well, let's talk about option number two.
So Brian, if folks want to start putting in their questions, they certainly can.
Absolutely.
At the bottom of the screen, there's a box that says Q&A with a little, little thing that sort of where a message would go. Just click that, and then a screen will pop up where you can write your message. But again, Brian and Bill will work on the answers when we get closer to the end of the presentation. So just wanted to make sure people knew where to put in their question.
Oh, perfect. Yeah, that's much better than writing it on a sheet of paper. Yeah, just put it in the comment section or that question and answer section at the bottom of the Zoom meeting thing, and then we'll tackle those questions at the end. Thanks, David. So option number two. Now, there's a reason why it's blank right now, because I'm going to tell you guys, there is nothing wrong with option number two. Thousands and thousands and thousands of people go on to option number two all the time. However, option number two works differently than option number one does. It actually works the opposite. So option number two is not like having a car. It's much more like being on a bus. Again, nothing wrong with being on the bus. Option number two was designed to save money. And it actually does. It actually saves the government money. It saves the consumer money. So it's not a bad thing. It just works differently. So it's designed to save money. It is not designed for freedom and flexibility because it's a bus. Now, when you go on option number two, you only show one ID card. That's a big difference because earlier we were showing 3 ID cards. No. On option number two, you only show your one ID card. So if you want to jot this down, that just came on the screen where it says Medicare Advantage program. This is what is heavily advertised all the time on TV. You guys are about to see advertisements like you've never seen before, because in about a week from today, it's going to be the Medicare enrollment period. And when it's Medicare time, every commercial has to deal with Medicare, Medicare Advantage plans, Medicare this and Medicare that. So it's going to be a bombardment of this stuff in the next few months. Now, Medicare Advantage is also known as Part C. Now, that letter C, it stands for combines, okay? So it's basically going to combine everything underneath one ID card. It combines your Medicare, so you do not show your Medicare card if you choose to go on Medicare Advantage. It combines your Medicare card with your supplemental insurance and your drug plan. Drug coverage is included in most of pretty much all of these Advantage plans. So underline Medicare Advantage or underline Advantage because that's the key terminology. But it works differently. So if you notice the next bullet point now, it says network of doctors. If you go on the Medicare Advantage program, you need to go to the doctors that are covered by your Advantage plan, which is called the network of doctors. So you're not in the car anymore. You cannot go anywhere you want to go. You have to go where your Advantage plan will let you go, which is perfectly fine. It's perfectly adequate, especially around Richmond. Bon Secours and HCA and VCU Medical, a lot of these entities, Ortho Virginia, Virginia Eye Institute, a lot of them are in the network. The doctors you currently go to, if you do go to doctors, would probably be in an Advantage plan. But this is why if you guys have any friends, if they say something like, well, I'm on Medicare, but I have to go to Humana doctors. That's okay. They just chose a Humana Advantage plan. Now, if they went with an Anthem Advantage plan, they just have to go to the Anthem Advantage plan network of doctors. It's just the way they work. Now, when we do go to those doctors, if you noticed on your screen, there are going to be some copays involved. And there's a copay for every service. A lot of people ask me, what do I mean by every? All, ALL, all services, you would have a copayment. Let me give you some examples of some copayments. If you went to a specialist, you'd have to pay a $35 copay at a specialist. Your insurance pays the rest. What if you need an x-ray? Well, your insurance company pays the majority, but you'd pay about a $50 copay for an x-ray. What if you needed an MRI? Well, your insurance company is going to pay for the MRI, except you have to pay your $200 copay to get an MRI. And if you rode in an ambulance, the copay for ambulances is usually right around $250. If you go to the emergency room, it's going to cost you a $100 copay typically. If you go to physical therapy 3 times a week for 6 weeks, you're going to have a copay 3 times a week for 6 weeks. There's just copays involved for every service. There's copays for drugs. Every time you pick up a drug, you'd have some kind of copay. I know I'm beating this up, but people forget there's copayments involved. Now, why on earth would anybody want this Medicare Advantage program if they have to go to certain doctors and they'd be paying copays for everything? Well, it works exactly like the bus. So let's talk about paying for a Medicare Advantage plan. Now, if you notice what just came on the screen, I'll have you write that down, but it says $148.50 for Part B's monthly payment. You still have to pay for Medicare. You have to pay for Medicare Part B. You got to have Medicare before you can get a Medicare Advantage plan, before you can get a supplement plan. So whether you choose an Advantage plan or a Medicare supplement plan, either way you go, you have to at least pay the $148.50 for Medicare. Now, for your Advantage plan, which is separate, so Medicare is one thing, your Advantage plan would be another, it works like the bus. If you noticed on your screen now, you can put a little plus sign, the dollar emblem, and a big zero, and then write the words Advantage Plan monthly payment. So it looks like I'm paying for Medicare, but I don't have to pay anything else per month for my Advantage plan, which is true. So the large majority of Advantage plans in our area don't cost anything per month. So earlier, when people had a supplement plan and they were paying $115 for a supplement, and then they were paying another $30 for a drug plan, God, that's an extra $145 a month. Well, instead of paying for a supplement and a drug plan, they can go on to Medicare Advantage and not pay anything per month. They love to tell their friends, I don't pay anything per month. I don't pay nothing for my Humana plan. I don't pay nothing for my United Healthcare plan, which is true. They're not paying anything for their Advantage plan, but they are still paying for Medicare. All right. That should raise a red flag. That might raise an eyebrow to sophisticated people, because how can you guys buy insurance and pay nothing for it? That just sounds weird. How can you buy an Anthem plan or a Humana plan or an Aetna plan for nothing? Well, it's not free. It just doesn't cost the consumer anything. It just doesn't cost you anything. See, here's what happens. When people go on to Medicare Advantage, they stop showing their Medicare card, like I mentioned earlier. And the reason why they don't show their Medicare card is because Medicare is not paying 80% of their doctor bills anymore. Medicare stops paying the 80% for doctors and hospitals. Instead of Medicare paying 80%, Medicare gives the Advantage plan company that you've chosen right about $1,000 a month every month. Whether you used your Advantage plan that month or not, Medicare is going to give Humana, or Medicare is going to give United Healthcare, or Medicare is going to give Aetna about $1,000 a month. And Medicare doesn't have to worry about you guys going to the doctors or the hospitals. Medicare gave the money to those insurance companies, and those insurance companies have to pay your bills and you have to pay your copay. But that's how Medicare Advantage plans work. And if you think about it, a lot of times, most people don't pay out in copayments as much as they would have paid every month buying a supplement plan. So people, especially the healthy people, they save money as a consumer going on to Medicare Advantage. Now we got to stop here and we're going to pause here for a second, because that's how Medicare Advantage works. And that's what happens when you go on to Medicare Advantage. But here's something that is vitally important for people to know. So this is about the most serious thing that we're going to talk about tonight, is switching plans. Because nobody really understands the old switcheroo, the old switching of plans. Now, I'm not telling you guys to do that or do this. I'm just using this as an example. Let's pretend you chose option number 1 first. Okay, so you chose the car, you chose the Cadillac plans, you chose a Medicare supplement plan. Good news, great news, you can keep your Medicare supplement plan forever. It's yours. It would move with you. It would travel with you. It is literally yours forever. It's guaranteed for life. There's very few guarantees, and that's actually one of them. It's guaranteed for life. So you can keep your supplement plan forever. The problem with the supplements is they do go up a little bit in price every year. Well, if your price goes up a little bit every year, sometimes the price goes up to a point where people may or may not be able to afford it. And they start looking at switching plans. Here's something that's important. You can move from a supplement and go over to the Advantage program later. So you can move from option number 1, supplement, over to option number 2, Medicare Advantage. You can go from the car and jump on the bus. The bus will always take you, regardless of your health. That's why we see a lot of advertisements for Medicare Advantage. It always will take you. Okay, so you can start on the car and jump on the bus later. Or you can start on Medicare Advantage. You can start on option number 2. Okay. Here's a biggie. This is a big deal. The rule. Here's the rule. There are a very few exceptions to the rule, but here's the rule. The rule is once you go on Medicare Advantage, you have to understand you're not going to come off of Medicare Advantage ever. Say that again. Once you go on Medicare Advantage, you have to understand you will be on Medicare Advantage the rest of your life. So the analogy is once you go on the bus, you're not coming off the bus. If anybody remembers the old Eagles song, Hotel California, welcome to Medicare Advantage. You can check in, you just can never leave. So what's this enrollment period that comes along every year? What is that for? That enrollment period is for people who want to leave a supplement and jump onto a Medicare Advantage plan. They want to jump on the bus. Or if they are on Medicare Advantage, they can change seats on the bus. So if they don't like their Humana Advantage plan and want to move over to the Anthem Advantage plan, that's no problem. Just call us. We'll move you from a Humana plan to an Anthem plan. You can do that. You can move from an Anthem Advantage plan to a United Healthcare Advantage plan. You can change seats on the bus. You're just not getting off the bus. If you move from Anthem to United Healthcare, you just have to go to United Healthcare doctors and pay the United Healthcare copays. But that is the biggest misnomer with this whole Medicare thing, is people don't typically understand. And a lot of people think, I'm going to go on Medicare Advantage early because I'm so healthy, and I'll just go later and go get the supplement plan. Lots of people are in for a very rude awakening if they want those supplements later, because about the time you want it, you can't buy it. So that's very important for you guys to know. So with that being said, it's about 20 minutes after 6. We're going to try to wrap up around 6:30. I'll give it a little more window here, but
let me just say this, folks. We may have some questions that require Brian and Bill to go a little past 6:30. If your question gets answered and you're good, I know people have to drop off, but we will go longer to make sure that questions are answered. I just want to make sure that we may not just shut the window at 6:30 just to honor the 6:30 stop time, because I know sometimes people are okay with going a few minutes over because of the information is beneficial. So if you need to drop at 6:30, we understand. And of course, if you need anything from the Boomer Group, you certainly know how to contact them, or you can work through your Equity Concepts advisor for that introduction as well. So I know it's interesting to hear that they can't reach out to you. That's just how they're regulated, and they do a good job, and they have to stay compliant to those guidelines that they're sworn to. So with that, I'll turn it back to Brian and Bill.
Perfect. Well, thanks so much. Well, then, Bill, I'm going to let you read the questions because Bill's probably better with a computer than I am. So, Bill, do you want to read the questions and we'll kind of answer those? Oh, I can't hear you, Bill.
Unmute. Sorry. Hear me now?
I can't hear you, and you're going to want to probably yell a little bit.
Yeah, I had to unmute. First question is, what is the right age to make the decision about your coverage?
Okay, the right age. So again, I think that question was, what is the right age for you to start thinking or making a decision about your coverage, like your Medicare coverage?
Yes.
So that depends. So I love to see customers when they're turning 64. Because if we can talk to everybody who's turning 64, we can kind of get the gauge to find out when are they going to retire. And if they're not going to retire at age 65, what does their group insurance look like? Because there is a lot of times when people should stay on their group plan after the age of 65. Now, depending on the group plan, if they stay on that group plan, that person may or may not need to enroll into Medicare. And I know what everybody gets told. Everybody loves to talk about the penalties. They say if you don't sign up, you'll get penalized. If you don't enroll, they're going to take you to jail. All those things are not true. Certain people need to do certain things. Other people don't need to do anything. So if somebody's 64, we can start that discussion and find out what they should or should not do. And the other thing is there's a lot of people who are covered by their spouse group insurance. And maybe the spouse should stay on the group plan, but maybe the person who's on the group plan, like for instance, Chesterfield County. We do a lot with Chesterfield County Public Schools. And even when the school teacher, let's just go with school teacher, the school teacher is still employed, but their spouse who might have retired is on their group plan. You don't want to keep them on that group plan. That group plan is very expensive for the spouse. The group plan is great for the employee, but if the spouse is eligible for Medicare, they don't want to be on that Chesterfield County plan. The spouse needs to come over to Medicare. It saves them piles of money and they can get better coverage. So the answer to at what age or when, we would love to see people when they're 64. If they're over the age of 64, we'd happily answer any questions that they do have pertaining to Medicare and whether it's right or wrong for them to do what they need to do personally. Hopefully that answers that question. Bill?
Next question, retired 5 years ago.
Lucky.
On spouse's employee insurance as dependent. Any issues?
Okay, retired 5 years ago, and they've been on their spouse's group health insurance. Is there any issue? Is that the question?
Yes.
Well, again, that depends because remember, everybody, Medicare is individualized. So as long as that group plan is a good group plan and it's an affordable plan and people like the plan, then for most cases, they can stay on that group plan and be perfectly fine. Now, the issue starts happening when the spouse wants to retire. So if I was covered by my wife's group plan and I'm over the age of 65, you better start planning on when that spouse is going to retire, because if I'm over the age of 65, covered by my wife's group plan, switching over to Medicare is not like a light switch. It's a process. And that process begins with our arch nemesis, which is the Social Security Administration, because they are the slowest group of people you'd ever met in your imagination. They are on island time. So I would tell you, you're perfectly fine staying on a group plan. It might be better for you to come off. We could always look at the numbers to see if it would be better for you to come over to Medicare, but be very aware of when your spouse is about to retire, about 90 days. So 90 days before your spouse retires, give us a call and we can walk you through each step of the road to make sure there's a smooth transition there. So, okay, Bill.
Option 1, for Part D, if I do not choose to pay for Part D, will I be penalized later if I want to continue paying for Part D?
Did you say D like drug coverage?
Yes.
Okay, so the question is, if I don't buy a drug plan, if I don't get drug coverage under Medicare when I'm supposed to get drug coverage, and then later I do go get drug coverage, would I be penalized? Yes, actually, yes, you would be penalized unless you were covered by a group health plan. So if you were covered by your spouse's group health plan, you would not be penalized. If you were covered by the Veterans Administration, which we're not going to talk about, but if you were covered by the Veterans Administration and then you signed up for a drug plan, you would not be penalized. But the large majority of people who do not buy a drug plan when they were supposed to buy a drug plan, and then later they go to get one, those people are absolutely penalized. And that penalty is a lifetime penalty. They add a monthly fee to your insurance for the rest of your life. There is no reason to not buy a drug plan. People need to buy a drug plan. I mean, the cheapest drug plan right now is $7.30 a month. That's less than a Starbucks coffee. Like, people need to get a drug plan. But some people opt not to.
Next question, do I need to reapply each year for my supplement?
Oh, thank the Lord, no. So the answer to that question is no. Thank God. because we've got over 7,000 customers. And if I had to talk and touch every 7,000 customer, I would quit my job. So what happens is when people have the car, their Medicare supplement, they're on autopilot. They do. If you chose option number one, a Medigap plan, you do not have to re-enroll. You do not have to re-sign up. Things just carry year after year after year, and you're good. That's also the case for some of those Medicare Advantage plans. Most, not all, but most of those Advantage plans, they just automatically roll you over, re-enroll you every single year. So I know what the TV says, and I know what Joe Namath on TV keeps trying to talk people into, switching plans and changing plans and getting the entitled things that people are entitled to. Geez. No, I tell people, if you like your plan, stay with your plan. You do not have to change it if you like it. So good question.
Option number one, can we change supplemental enrollment whenever we wish?
Can we change supplemental enrollment whenever we wish? So I think that question is, if I have a Medicare supplement plan, if I have a Medigap plan, if I'm on the car, right? If I'm on a Medicare supplement plan, can I switch? The answer is maybe. So let's talk about when you can switch. Here's something that very few people know. You are allowed to switch your Medicare supplement plan anytime throughout the year. I'm going to say it again. You can switch your Medicare supplement anytime throughout the year. It's just like switching life insurance. So you can switch life insurance at any time throughout the year. But to move from one supplement plan to another supplement plan, for instance, if you wanted to move from a Humana Medicare supplement to an Anthem Medicare supplement, the new supplement company, Anthem, in this example, Anthem gets to ask you medical questions and go through underwriting. And if they don't like the answers you put on your application, the new supplement company does not have to take you at all. They can absolutely deny you to get or change to a different supplement. That's why it's very important to pick the right Medicare supplement from the beginning, because if you pick the right one from the beginning, you never have to worry about it later. But you can change, you just have to go through medical underwriting. Most people just keep their same supplement plan forever, or they go from a supplement and they just jump over to Medicare Advantage later. But that's a good question.
So we are at 6:30. There is 3 more questions. I am going to say officially, thank you folks for attending Equity Concepts Nation. You guys are awesome. And we're still going to continue live and finish the last 3. But I just want to make sure people know that I know maybe, the steaks are cooking. It's time to go eat. But we're going to stay live. And if you need us tomorrow, we'll certainly be there too. So back to our experts. Thanks, guys.
Thanks, David. All right, Bill.
What if I'm covered by my husband's company insurance?
That's a very similar question from earlier. What if I'm covered by my husband's company insurance? Well, we got to be careful, because also if you're covered by a group health plan, that employer, that group health plan has to have more than 20 full-time employees. So the size of the company your spouse works for absolutely matters. So if it's a company that has more than 20 employees, you can absolutely stay on that plan. You do not have to come over to Medicare. You might want to look at your Medicare options because you might be able to save some money, but you would not be required to come over to Medicare, and you would not be penalized later if you left the group plan and came over to Medicare. So there's no penalties for that person who's been covered by a group health plan. But I'm going to take that one step further. We were actually meeting with one of the equity concept advisors not too long ago. And it was a man, there was an employee. So there was a guy and his wife. His wife was a little older than he is. And his wife was asking him about Medicare. So the employee, the husband, went to the human resource people and said, hey, human resource, my wife's turning 65. She's asking me about Medicare. What do we do? And the human resource person did not lie. They told the truth, which is perfectly fine to tell the truth. The human resource person said, oh, don't worry. Your wife can stay on the group plan. We've got 800 employees. She can stay. It's the exact same thing and won't change a bit. So that's the truth. That wife, that spouse, was allowed to stay on his group plan, but her portion of the group plan was costing them $700 a month. So could she stay on the group plan? Yep. Was it costing her husband $350 out of each paycheck every 2 weeks? Yep. Did they have a $3,000 high deductible plan? Sure did. So that poor lady was still paying $700 a month for a $3,000 deductible plan. Thank God they worked at Equity Concepts, with their advisor, because their advisor said, hey, call Boomer Insurance. Let's talk about this because your wife's turning 65. Let's visit about it. And at the end of the day, we removed her from her husband's group plan. He got a $700 raise, which he was pretty happy about. His wife then went on the Medicare supplement plan. And by the time she bought a supplement, bought Medicare, and bought a drug plan, she was paying about $300 a month, about $280. But if she was paying $700, now she's paying $300. That's a $400 a month savings. And her equity concept advisor told him to go ahead and put that $400 back into his 401k. So now he's got an extra $5,000 a year he's being able to put tax advantage into his 401k. I mean, it's a no-brainer. It's a win-win. And his wife got better insurance. So it does pay to work with good financial advisors for sure. But you can absolutely stay on your husband's group plan. It's just, do you want to or should you is a good question. Hopefully that answered that question too. Bill?
This one you've kind of already answered. Can you switch between supplemental plans at any time or only during the open enrollment period?
So can you switch between supplemental plans at any time or just during the enrollment period? So yeah, that is very similar to the earlier question. You can switch a Medigap plan. You can switch a Medicare supplement plan anytime throughout the year. You just have to answer medical questions, go through underwriting, and the new plan can or does not have to take you. So it's up to the insurance company whether they want you or not. But you can change the supplement any time of year, whether it's an enrollment period or not. Bill?
Next question. Is there any data showing the overall out-of-pocket expense comparing the two options? It's understood that different illnesses could be devastating.
There are lots of different case studies and, hypothetical illustrations of things. They're all over the internet. But on an average, so the industry standard, the industry average is people who go on a Medicare Advantage plan, and those people stay on an Advantage plan their entire life from age 65 until 85. Those people typically save around $25,000 over that time span. Now, that's the average person. That's not a super sick person. That's not a super healthy person. That's a normal person. That's somebody who's 65, goes to a few doctors a year, goes to a few specialists a year. They go to an eye doctor. They go to their family doctor. They see an endocrinologist. They pay very small copays. but statistically, they don't pay as much in copays with an Advantage plan as they would with a supplement plan. But then they get sick or then they get injured. Now, it's usually men, because men love getting on ladders for some reason, especially after the age of 80. I know they've been doing the same gutter clean out in November every year for the past 50 years. This is not my first day. They all fall off the ladder, they break something, and then they spend weeks in the hospital or they have to have surgery. And if they're on an Advantage plan, they're going to end up paying $2,000 or $3,000 worth of copayments. But that's every blue moon. That's every so often people finally get sick or they get injured and they have some copayments. But over the long term, people who go on Medicare Advantage do save money statistically on average. People who choose Medicare Advantage, they're not worried so much about the cost savings. People choose a supplement because they want to go where they want to go, whenever they want to go, and not have anything to worry about. It's a luxury plan to have a supplement.
Do the Advantage plan premiums increase as you age or stay the same? How does that compare to the increased premiums on the Medicare plans?
That's a really good question. That's actually said very well too. All right, so the question is, do the Medicare Advantage premiums, do the Medicare Advantage monthly payments go up from year to year? And if so, how do those increases on the Advantage plans look different from a supplement plan? So let's talk about that. A Medicare supplement plan, the fancy plan, the supplement pricing will go up a little bit every year, and every company does it. So Anthem will raise their rates a little bit every year on your supplement. Humana will raise your rates a little bit every year with your supplement. Aetna will raise your rates every year with your Medigap plan. So those supplements, Medigaps, go up a little bit every year. Medicare Advantage, on the other hand, has been very stable since it came out in 2006. So especially around metropolitan areas, they've been zero. The Medicare Advantage plans have remained zero for the majority of the plans since 2006 when they came out. Now, if you get into the rural areas like New Kent or Buckingham or Cumberland County or, some outlier counties, then yeah, sometimes those Advantage plans go from $0 to $8 or $10 a month, but they're still very reasonable in terms of the monthly payment for an Advantage plan. But by far and away, Medicare Advantage has stayed at a $0 monthly payment for years. Okay. Bill, is that?
That's all I see. Well, there's one more.
One more.
Can you
Bonus
speak
round.
to dental and vision?
Was it something about dental and vision?
It says, can you speak to it?
Yes, absolutely. That's easy. So first things first, never buy vision insurance unless you're buying it through your group plan. So if I worked for a big company, like if I was working for DuPont, if I was working for Dominion Energy, if I was working for Haley Toyota or a good sized company, even I would buy vision insurance because it's usually only a couple of dollars. So that's okay. Now, as soon as I go over to Medicare or as soon as I come away from a group health plan, I'm not buying vision insurance because it is not worth the money that you would pay for a vision insurance plan. And this is coming from somebody who has to take eye drops all the time. And if you see me rubbing my eyes, it's because I actually have eye problems. But I wouldn't buy vision insurance because Medicare and Medicare supplements or your Advantage plan is going to cover the medical conditions of your eyes. So if you need a cataract surgery, cataracts don't fall underneath vision insurance, they fall underneath medical coverage. Glaucoma, retinopathy, macular degeneration, all these types of eye care are filed underneath your medical coverage, which is wonderful with Medicare. But the only thing you would have to probably pay for is just pay for your glasses. Now, if you buy $800 pair of glasses, that's a choice. You can always find other places to choose that are not $800, but I know Libyan Grove Eye has some beautiful, wonderful, super nice glasses that can be $1,200, $1,300, or people can go to a local place and get normal cost glasses. So that's vision.
Brian and Bill, you've done a fantastic job because most of the folks have stayed on. You're doing a really good job adding value and in keeping people informed. I do see there is another question that's popped up that I'm surprised hasn't come up, but maybe this is the one we'll end on. Maybe not. So I'll let Bill share the question.
Well, if I can, I'm going to jump right before Bill does that. Dental. So that vision, don't buy it. Dental, I absolutely find value in dental insurance. Now, people will tell you whatever their opinion is. I'm a mathematics person. So if it does not make mathematical sense, I'm not buying it and I'm not doing it, which drives my wife crazy. Anyway, so what happens is dental insurance is a pretty good value. And I would recommend people buy dental insurance when they do come over to Medicare. And we can talk about that, why that is at a one-off kind of thing. But I do recommend people buy dental insurance. We don't even sell dental insurance here because we only deal with Medicare insurance plans. But dental is a good thing to buy. So, all right, sorry. Bill, last question. We're going to end it with a drum roll probably. All right.
That's one. My wife and I plan on traveling after retirement. How do the Advantage plans work if you are out of your normal area, say Virginia? Maybe I'm in Wyoming.
Okay, so if somebody has, I think the question is traveling on an Advantage plan insurance.
Yes.
Okay, so Medicare Advantage plans are not designed to be convenient. So if you are traveling and you have a Medicare Advantage plan, you only have emergency benefits. So if you're in, was it Utah, Montana, where was that?
Wyoming.
Wyoming. If you're in Wyoming and you break your leg, you need to go to the emergency room. Do not pass go, do not collect $200. You got to go to the emergency room. And the emergency room is going to be completely covered, just like you were here at St. Mary's or St. Francis or VCU or Henrico Doctors. It's covered like you're in the network. Where the problems happen on Advantage plans is when people are out of their area and they get hospitalized. That's a billing nightmare. Our clients, if they are our clients, we will help them with the billing nightmare that ensues because all those bills will get declined and denied from the Advantage plan company because they're all out of network, but they're supposed to be covered. Another issue with traveling with an Advantage plan is like one of our customers, she lives in Virginia Beach. Her sister lives in Tallahassee, Florida, and she likes to go to see her sister, spoiler, in January, February, and March. So when it's cold and snowing here, she wants to go to Tallahassee and hang out with her sister. She's on an Advantage plan. And this customer of mine got really injured in Tallahassee. She broke her shoulder. She got ambulanced to the emergency room, and they did a surgery for her in Tallahassee. The ambulance was covered, no problem. The emergency room was covered, no problem. The surgery we got covered eventually, so it was no problem. But she didn't want to come home after her surgery. She wanted to stay at her sister's house. She needed physical therapy. Physical therapy is not emergencies. She only has emergency coverage, so her choice was to either pay full price and not going to get reimbursed. She had to pay the whole price in Tallahassee for all of her physical therapy, or she had to come back to her home base, Virginia Beach, and pay her co-payments for her physical therapy. And that's what she ended up doing. She came back from Florida, spent 3-4 weeks in Virginia Beach. She got her rehab completed. She paid her co-pays. And then after she was better, she actually went back to Tallahassee. So traveling on Advantage plans gets a little dicey. But again, they're designed to save money. They're not designed for freedoms and flexibilities.
That's all the questions that we have, my friend.
All right. Well, then I'm going to let you guys enjoy the rest of your evening. And if you do ever have any questions about Medicare, Medicare insurance, which one's right or which one's not right, I'd be more than happy, and Bill would be more than happy to answer any question you could possibly have relating to this subject. And thank you, David, 1,000 times for allowing us into your home and your neighborhood and your friends and your clients. And we're happy to help in any way. So
Beautiful. And so good night, Equity Concepts Nation. And if you need us, how to get a hold of us, and we'll be here to serve. So remember, there's 2 types of systems, and the people that are with Equity Concepts are informed. So good night, and we will see you soon. So thank you.
bye, everybody.